Okay, so mitral valve prolapse. So very common form of valvular heart disease, and the prototypical patients are going to be young women who present with chest pain, palpitations, lightheadedness. The other population you should think about will be connective tissue disease, so Marfan syndrome. So if you see that, you should be thinking about MVP. The exam, there will be a mid-systolic click, and again, if they give you this information, you're done because this is the only condition associated with a mid-systolic click. And then that's followed by holosystolic murmur over the apex, and it occurs late in systole. The first time I ever heard an MVP murmur, I thought I was listening to a diastolic murmur because there's S1, and then a pause, and then the murmur. Because you don't always hear the click, and if you hear the click, you might confuse it with S2. So you hear the S1, pause, and then a click murmur. And the first time I heard it, I was like, is this a diastolic murmur? And then I had to listen a bunch of times and realize that it's a systolic murmur. But it's late in systole. It's really the only murmur that happens that late in systole. The intensity decreases with increased blood flow, as we talked about. And really, again, it's really the click and the murmur occur later. That's the truth of the matter. Intensity increases with decreased blood volume.